Bismillahirrahmanirrahim. I'm Fawad, Assistant Professor, Department of Pharmacy, Port University of Science and Technology. Welcome to the course Pharmaceutical Clinical Pharmacy 4. Today, the topic of our discussion is conjunctivitis. Outlines. We will discuss the following contents one by one: definition of conjunctivitis, symptoms, types, bacterial conjunctivitis, allergic conjunctivitis. These are the contents we will discuss inshallah one by one. Okay. First, starting with the uh, with the with the definition. This is the lecture outcomes. After watching and listening, this student will know about the bacterial conjunctivitis. Differentiate. A student can differentiate easily between a bacterial conjunctivitis, allergic conjunctivitis, diagnosis and treatment, definition and symptoms. Conjunctivitis, a common external eye problem that involves the inflammation of conjunctiva. Is a common external eye problem that involves the inflammation of the conjunctiva. The region in there is an inflammation in the conjunctiva region of the eye is known as the conjunctivitis. Symptoms: there is diffusely red in eye, purulent or serious discharge, accompanied by itching, smarting, stinging, scratching, foreign body sensations. Patient with pain, decreased vision, like if a patient with pain, decreased vision, unequal distribution of redness, irregular pupil or opacity should be referred immediately to an ophthalmologist because these are the signs of more serious eye disease. Like if the patient have a pain, decreased vision, uneven distribution of redness, irregular pupils or opacity should be referred immediately to the ophthalmologist to know the signs of this disease. This is basically an eye, like this is a cornea region, this is the mucus layer, this is the water layer, and this is the oil layer. Okay, this is basically the conjunctiva. This is the conjunctiva region. Inflammation or redness in this region is known as the conjunctivitis. This is the lacrimal gland. This stimulates the lacrimations. Types: conjunctivitis, pink eye, can be bacterial, fungal, parasitic, viral, allergic in origin. Conjunctivitis is a pink eye, can be bacterial, fungal, parasitic, viral, or allergic in origin. Viral conjunctivitis is generally a self-limiting. The second one is the bacterial conjunctivitis should be treated with an appropriate antimicrobial. Recognizes the gram-positive organism the frequently the problem. Bacterial conjunctivitis should be treated with some proper or appropriate antibiotic. Recognizing that the gram-positive, in most of the cases, gram-positive organisms are frequently involved in causing the bacterial conjunctivitis. A number of agents are available for the treatment of allergic conjunctivitis. A number of agents are available for the treatment of allergic conjunctivitis. Gonococcal conjunctivitis is an ocular emergency, and the patient should be referred immediately to an ophthalmologist to minimize the potential of the corneal perforation. So these are the types, and now we're discussing what is bacterial conjunctivitis. These are the bacterial conjunctivitis. Like this is the redness. You see redness. This is the healthy eyes, early stage infection, like the thing, and this is the late stage infection. The amount of the inflammation increases. So they differentiate normal eye, early stage infection, and late stage infection of bacterial conjunctivitis. Bacterial conjunctivitis, most of the bacterial conjunctivitis are caused by the Staphylococcus aureus, Staphylococcus pneumonia in a temperate climate, or Haemophilus aegyptus in warm climate, although a number of other organisms may be responsible. The infection usually starts in one eye, like the bacterial conjunctivitis. The infection usually starts in one eye and spread to the other by the hands, and it also may be spread to other persons, like they can be easily transferred from one person to other. And the spreading is most commonly from one eye to another eye is because of the hands. Unlike bacterial conjunctivitis, corneal infection can obliterate vision rapidly. Therefore, accurate diagnosis is important. Like in bacterial conjunctivitis, corneal infection can be obliterate vision rapidly. Therefore, accurate diagnosis is important. Case study: acute bacterial conjunctivitis, pink eye. Like LD is a 6-year-old boy with a diffuse bilateral conjunctival redness that has been present for 2 days. A crusting discharge is deposited on his lashes and the corners of his eyes. His vision is normally and his pupils are round and equal. The diagnosis of the acute bacterial conjunctivitis is made, and sodium sulfacetamide 10% ophthalmic drops, 2 drops in both eyes every 2 hours, while awake are prescribed. What other measures could be used? What instruction should his caregiver receive? Okay, treatment. Although the treatment of atypical bacteria, treatment of typical bacterial conjunctivitis such as this is empirical, a culture should be obtained. Other ophthalmic antibiotic drops or ointment can be used, such as like neosporin. Like first, a culture should be obtained to have a culture sensitivity test for the to prescribe some proper antibiotic. Other ophthalmic antibiotic drops are like neosporin, neomycin, polymyxin B, gramidacin combination. Second line therapies like antimicrobial such as the ocular quinolones. These agents should be reserved because of the cost and the potential development of resistance. Like quinolones are used as a second line therapy because of the reason, like they are expensive and they have the potential to develop resistance. Management. Proper management of this infection also include mechanical cleaning of the eyelids and hygienic measures that prevent the spreading the infection to the other children. The deposit should be removed as often as possible with a moist cotton swabs or cotton strip applicator. A mild baby shampoo can be used to moisten the applicator. So these are the some like management of this infection. Good mechanical cleaning. The deposit should be removed. Firm adherent crust may be softened with warm moist compresses because this material is infectious and it should be disposed of in a sanitary fashion. The common use of washcloth by several individuals will spread the bacterial conjunctivitis. The common use of the washcloths by several individuals will spread bacterial conjunctivitis. These are the management and treatment of the normally and bacterial conjunctivitis, allergic conjunctivitis. This is the case of allergic conjunctivitis. Like in allergic conjunctivitis, for example, a case study is NV, a 10-year-old girl, has an experienced redness in both eyes, accompanied by the hay fever for the past 2 months, June and July. But in the case of the bacterial conjunctivitis, the infection is produced in one eye, which is spread to another eye by the hands. There is no crusting on their eyelids, but in bacteria there is a crusting. And her vision is normal. She rubs her eyes often because they are itchy. What treatment is best for the NV allergic conjunctivitis? This is allergic conjunctivitis. So, in this case, the treatment topical vasoconstrictor, for example, nefazoline, tetrahydrozoline with or without histamine. For example, entazoline, phenyramine may be used to treat the hyperemia, but they should not be used excessively because rebound congestion can occur secondary to the vasoconstrictor. So normally topical vasoconstrictor is used to treat the hyperemia. Therefore, the use of the topical vasoconstrictor for longer than 72 hours is not recommended. There is a restriction drawback that the prolonged use of the topical vasoconstrictor is not recommended for more or longer than 72 hours. Antihistamine tablet, because this is an allergic, so antihistamines tablets or syrups can provide concentrable but temporary relief. So this is the number third. Ophthalmic histamines like H1 receptor antagonists are effective in treatment of allergic conjunctivitis, like levocabastine 0.5% is administered BID to QID 2 times to 4 ID. Olopatadine 0.1% BID separating dose by 6 to 8 hours or 0.2% one daily. Amidestine 0.05 QID. Ketotifen 0.025% BID to QID. Cromolyn sodium ophthalmic, this is a master stabilizer, 4% 4 to 6 times a day. Ketotifen, olopatadine, azilestine, and epinestine exhibit both antihistamine and master stabilizer effects. So they are ocular non-steroidal anti-inflammatory drugs for the seasonal allergic and vernal conjunctivitis, like bromophenib 0.1%, 1 drop BID, diclofenac 0.1%, 1 drop every 2 hours for 48 hours, then QID. Ketorolac 0.5%, 1 drop QID. So these are the ocular non-steroidal anti-inflammatory drugs for the seasonal allergic vernal conjunctivitis. They have the NSAIDs and they have the anti-inflammatory property. So here is the reference like Koda Cambla, Sandley, Chairman, and Merle, Garrett, B. Peterson, later. These are the references. Thank you so much for listening.